Patients and caregivers are taught how to care for a central line by a healthcare professional, either at Roswell Park or at home. This video offers a step-by-step guide to changing a central line's dressing and replacing the catheter caps. The video is designed to complement in-person training and any printed instructions you receive. Caregivers and patients may find it helpful to watch the entire video before starting the process. Caring for a central line can feel challenging at times. Through ongoing practice, you will gain confidence with these skills. Remember, you aren't alone in this. If you have any questions or concerns at any time, call the Home Care Service or Roswell Park Clinic where the patient receives care for assistance. Outside of business hours, call the Roswell Patient Helpline at 716-845-2300 and you'll be connected with someone who can help. An important note about hand washing. Always wash your hands properly before handling a central line. This includes vigorously scrubbing your hands with soap and water or an alcohol-based hand sanitizer for at least 20 seconds. Be sure to dry your hands with a clean towel. What is a central line? A central line is a thin, flexible tube that's inserted into a major vein in the patient's chest. The tube travels out of the body, allowing a route for medications, fluids, and nutrition to be delivered to the body and allowing for blood to be drawn if needed. The location where the tube enters the body is called the insertion site. A lumen is an extension of the central line, a tube that branches off the main line. The number of lumens a central line has is determined by the patient's provider. Each lumen has a clamp. The clamp may be a clasp or a slip type. It provides a way to control whether that lumen is open or closed. The catheter cap, also called a needleless connector, end cap, injection cap, or end valve, covers the end of the lumen and provides a point of access to the lumen. Sutures, or stitches, may be used to help firmly secure the central line in place. Lastly, the dressing covers the central line insertion site and helps keep the area clean, dry, and protected from germs or infection. It also helps hold the central line securely in place. A word about your workspace. You should set up a clean, dry, well-lit workspace that can't be accessed by children or pets. Avoid working around kitchen and bathroom sinks, as it's difficult to control splashes. Your workspace should have a hard surface that can be wiped down. If needed, a clean plastic or metal tray can be used. Disinfectant wipes should always be used to sanitize the surfaces where you will be working. After disinfecting, allow the surface to air dry before placing any supplies on it. You'll also need to set up an area to throw things away. It helps to have a designated space set aside where you can simply drop the items you wish to discard. Please note, it is helpful to wear short sleeves and remove all jewelry from your wrists and hands before you begin a dressing change. What supplies are needed? Let's look at the supplies you'll need for a dressing change. Central line care supplies may be ordered by your provider and picked up from your pharmacy or purchased as needed. Only use supplies that are designed for use with a central line. Do not improvise. Make sure to keep a sufficient stock of the supplies your provider has recommended for you at home so you never run out of what you need. Dressing kits, which come pre-packaged and contain all supplies specific to dressing changes, are commonly used. The supplies are stacked within the dressing kit in the order that you will use them. Face masks are used by the caregiver, patient, and anyone assisting with the dressing change. This is to make sure no one breathes, coughs, or sneezes on the uncovered central line. A pair of sterile gloves will also be needed. A word about gloves. It is important to understand the difference between clean and sterile gloves. Clean gloves are exam gloves that come packed in a box and are usually not individually wrapped. They're often seen in hospital exam rooms and doctor's offices. They are sold in bulk or over the counter at drugstores as well as online. They come in different sizes and colors. Sterile gloves look similar to clean gloves, but they are always individually packaged and the package is labeled sterile. Sterile means that what is inside the package is free from any germs. Dressing kits come with only one pair of sterile gloves. Additional pairs can be purchased at drugstores or online. Putting on sterile gloves requires following a step-by-step process. It may be helpful to practice with your healthcare professional or to review the section of the video that shows how to put them on before you begin. Be sure to pay close attention to which type of glove is specified for each step of central line care. Using the appropriate glove is important for infection prevention. The dressing kit includes an antiseptic cleaning device, which is used by the caregiver to clean the central line and surrounding area. One common type is a CHG, or chlorhexidine gluconate, wand or swab. CHG is an antiseptic or germ-killing liquid. Patients who are allergic to CHG may require a different antiseptic, such as povidone iodine or betadine, which comes in pre-soaked swabs or in bottles that are used to soak sterile gauzes or swabs to clean with. Next, there is the dressing itself, which may vary in type. The dressing you'll use at home may be different than the one used at Roswell. Common dressing types include CHG impregnated dressing, which is a transparent or clear dressing with an antiseptic CHG gel pad embedded in it. This type of dressing helps prevent infection by continuously releasing CHG. Tegaderm is another type of clear dressing, often featuring white tape around the edges. Opsite is yet another type of clear dressing. A biopatch is a CHG patch designed to be placed on the insertion site underneath a Tegaderm or Opsite dressing to help prevent infection. Your team will order this if needed. Note that patients allergic to CHG will use only a Tegaderm or an Opsite dressing. Also note that when a central line is initially placed, the radiology team may place gauze beneath the dressing. This type of dressing needs to be changed within 24 hours per the Roswell standard. Your provider may decide that gauze should continue to be a part of your dressing in the future. In this case, the dressing will continue to be changed every 24 hours. Dressings usually come with labeling tape on which you can write the date and/or the initials of the person who applied the dressing. Dressings may contain an additional adhesive tab, commonly called pants, that helps secure the bottom of the dressing to the skin. Next, we'll go over the supplies you'll need to change the catheter cap on each lumen. You'll do this when you change the dressing, which should happen at least every 7 days, or more often if it becomes visibly dirty or loose. An alcohol wipe is a sterile pad soaked in isopropyl alcohol. It is used to clean the area of connection between the catheter cap and the lumen. The alcohol helps remove germs and reduce the risk of infection. When using an alcohol wipe to scrub, it is important to scrub back and forth vigorously for at least 15 seconds and to allow the area to air dry completely. A new catheter cap in sterile packaging. You'll use a saline syringe to attach the catheter cap to the lumen. A word of caution: saline syringes come in sterile and non-sterile packaging. Most often, you will use non-sterile saline syringes at home. Non-sterile syringes are not sterile on the outside, but the saline inside and the tip are sterile. Make sure the tip of the saline syringe does not come into contact with anything except the new catheter cap you are attaching. A disinfecting cap is a device that can be placed on the end of the catheter cap when the lumen is not in use. It provides an extra layer of protection. These may be provided by home care or purchased. Kuros is a common brand. How to change the dressing. Now, let's look at how the caregiver changes a central line dressing. To avoid infection or other complications, follow these steps carefully and consistently. Begin by preparing the workspace. Wash your hands and put on a pair of clean gloves if available. Clean the surface and the workspace area thoroughly with a disinfectant wipe and allow to air dry. Take off the gloves and dispose of them along with the used wipe. Remember, do not touch the trash receptacle when throwing things away. Wash your hands again now. Next, gather the supplies and set them down on a clean surface. For teaching purposes, we're going to clean a central line that has 2 lumens using a CHG impregnated dressing kit. Now, once again, wash your hands to ensure they are clean before opening the dressing kit. Put on a new pair of clean gloves if applicable. Open the dressing kit and pull out the folded package. Open this package carefully by touching only the outer 1-inch perimeter of the blue drape. This is our sterile field. Remember that everything within the edges of the sterile field is sterile, and everything outside of the edges is not. Avoid talking over or reaching over the sterile field. Next, remove the face masks from the dressing kit without touching anything else. Put them on. One is for the caregiver, and the other is for the patient. Open the 2 catheter cap packages carefully and drop the caps gently onto the sterile field without touching the catheter caps themselves. Remove the 2 flush syringes from their packaging and place them on the clean work surface next to the dressing kit. Do not place them on the sterile field. How to remove the old dressing. Now we'll carefully remove the old dressing from around the central line. Start at the bottom of the dressing and gently peel back the reinforcement tape, or pants, that overlap the dressing. Take care to not pull or tug at the central line. Now gently loosen the edges of the dressing, working your way from the outer edges towards the insertion site in the center. Once the edges are loose, hold the central line at the lumens to stabilize it, being careful not to touch the insertion site. Continue peeling the dressing towards the insertion site until it's completely removed. Once the dressing is removed, dispose of it along with the gloves you were wearing. Examining the site. Now that the dressing is removed, you should pause to carefully examine the insertion site. Check the site and surrounding skin for signs of infection, including redness, irritation, discharge, pus, or swelling. Also, check for any missing or torn sutures if applicable. If anything appears abnormal, the caregiver can take a photo to share with the care team. Be sure to complete the dressing change before contacting the care team to report any abnormal findings. Call the clinic where you regularly receive care to report anything abnormal. After business hours, call the patient helpline at 716-845-2300 and you'll be connected to someone who can assist you. Be sure to make site examinations a regular part of your central line care routine. Using sterile technique to clean the line and site. Now we'll review how to put on sterile gloves to complete the dressing change. Feel free to practice this in advance as much as you need to feel confident with it. Start by washing your hands again. If your kit comes with a small packet of hand sanitizer, you may use it at this time. Let your hands fully air dry before continuing. Carefully remove the sterile glove package from the dressing kit without touching anything else and place it on your clean work surface. Slowly unfold the packaging, only touching the outer edges. The inside of the packaging and the gloves are sterile. We will put a glove on our dominant hand first. Your dominant hand is the one you use for skills like writing or eating. Mine is my right hand, so I will put this glove on first. Look for the location of the thumbs on the sterile gloves. This will help orient you when you slide your hand into the glove. Now, with your non-dominant hand, pick up the glove by the folded cuff. Slide your dominant hand palm side up, thumb tucked inward into the glove. Find the holes for your fingers first and insert your thumb last. Once your hand is all the way in, unroll the cuff, being careful to not touch the outer part of the glove, as that should stay sterile. Now for the other glove. Using your gloved hand and holding your thumb out of the way, carefully tuck your gloved fingers into the outer cuff area of the other glove and pick it up. Now, slide your non-dominant hand into the glove, again finding the holes for your fingers first and inserting your thumb last. Once both gloves are on, adjust the fingers or cuff as needed for a tight fit, touching only the outside of the glove. Now that both sterile gloves are on, avoid touching anything outside of the dressing kit as it is not sterile. You can touch anything inside the dressing kit as it is sterile. Keep your sterile, non-dominant hand away from your body and any surfaces to prevent contamination. You can make a fist with that hand as a reminder not to touch anything. If you do accidentally touch something non-sterile, you'll need to discard your gloves, wash your hands, and put on a new pair of sterile gloves. Cleaning the site. Now, let's clean the central line site and then apply a new dressing. Pick up the antiseptic cleaning device from the kit. You may need to open and discard the packaging to use the device. Begin at the insertion site. Using the antiseptic cleaning device, scrub back and forth in a spiral pattern, working your way outward. Be sure to gently scrub over and under your central line tubing as you clean. It is okay to use all sides of the antiseptic cleaning device. Do not go back and re-scrub any scrubbed areas with the same cleaning device. Clean an inch or two beyond the edges of where the dressing will go. Cleaning should take at least 30 seconds. Let the entire site air dry completely for at least 2 minutes. Do not fan or blow on the site. If your dressing kit contains a second antiseptic cleaning device, repeat the above steps using this. Continue to keep your sterile gloves away from anything that is non-sterile. Applying a new dressing. Now we'll put on a new dressing. While still wearing the sterile gloves, pick up the new dressing from the kit. While holding the edges of the new dressing, peel the paper backing off. You'll want to choose where the new dressing will go. Keep in mind the insertion site should be visible in the center of the new dressing when you apply it. For our purposes, the center of the dressing is the CHG gel pad located here. Use both hands to position the dressing sticky side down, centering the CHG gel pad over the insertion site. Press gently to apply the dressing and smooth it out, making sure all of the edges are adhered to the skin. Remove the paper frame from the top of the new dressing. Next, apply the adhesive tab or pants to the skin at the bottom of the dressing to help secure the central line in place. Save any remaining tape to label the date of the dressing change, but don't do this until after changing the catheter caps. This is to prevent contaminating your gloves prior to changing the catheter caps. Changing the catheter caps. While wearing the same face mask and sterile gloves, we'll proceed to change the catheter caps. Keep in mind that although you are still wearing the same sterile gloves, you'll now treat your gloves as clean rather than sterile. Moving forward, you still want to minimize what you touch to reduce the risk of infection. First, pick up one of the saline flush syringes that you set next to the dressing kit earlier. Unscrew the cover cap off of the syringe. Do not let the tip of the syringe touch anything that is not sterile. If it touches anything that is not sterile, discard it and use a new syringe. Pick up one of the catheter caps that you opened and dropped onto your sterile field earlier. Be careful not to touch either end. Now screw the tip of the syringe onto the catheter cap, turning it in a clockwise direction to fasten it. Remove the catheter cap tip cover. We will now remove any air that's in our saline syringe and catheter cap. Working to the side of and not over your sterile field, hold the syringe with the tip pointing straight up. Gently push the plunger until a drop of saline forms at the tip of the catheter cap. Now lay the syringe with the catheter cap attached in the center of your sterile field. Repeat the above steps with additional syringes and catheter caps as needed for each lumen. Next, we'll replace the old catheter caps on the ends of the central line's lumens with the new catheter caps we've attached to the flush syringes. This step requires proper hand placement, so feel free to review the video and practice this in advance to become familiar with it. First, be sure to visually inspect that the clamp is closed on each lumen of the central line. Open an alcohol wipe and use the wipe to clean the area where the lumen meets the catheter cap. Scrub it down on all sides for 15 seconds. Then, allow it to air dry for at least 15 seconds. Continue to hold the clean lumen with one hand. With your other hand, pick up one of the flush syringes that has a new catheter cap attached. Next, unscrew the old catheter cap and let it drop. You can dispose of it later. Immediately, screw the new catheter cap and the attached syringe onto the lumen. Do not allow the end of the lumen or the end of the catheter cap to touch anything else but each other. Be sure that the new catheter cap is attached, but don't over-tighten. We'll attach all the new catheter caps before moving on to flush each lumen. If at any time you cannot unscrew an old catheter cap, stop and move on to changing the catheter cap on the next lumen. Follow the above steps to change the catheter cap on each additional lumen. Now we'll flush the lumens. First, open the clamp on each lumen. We use a push-pause method to flush a small amount of saline each time. Now close the clamp on each lumen, then unscrew and discard the syringes. If you have any issues with replacing the catheter caps or flushing the lumens, be sure to call to report the issue to the clinic where you regularly receive care. Now, a disinfecting cap, if available, can be screwed on the end of each catheter cap. Finally, write the date of the dressing change on the label you saved. Then, apply the label here, over where the lumens come out of the dressing. The label helps you keep track of when the next dressing change is due. And that's it. You're done. These processes require attention to detail, but with practice, you'll find you can care for a central line with confidence. Revisit this video if you need a refresher, but remember that computers and phones are not clean and should not be touched during your care routine. If an additional friend or family member can assist, you can have them stop and start this video as you perform each step. Always reach out to your care team if you notice any signs and symptoms of infection, any issues during your routine care, or if you have any further questions or concerns. Thank you for taking infection prevention seriously, and thank you for watching.